everyone, and welcome back to Talk to Talk. I'm Dani, and today's discussion we're going to be discussing mental health issues as we are promoting Mental Health Awareness Month for this month. As I stated in my last video that I'd be speaking to a guest who we are very grateful to have here today, Suhayla. Hey.
Hey.
And me and Suhayla are going to be discussing a few issues around mental health and promoting a mental health condition that Suhayla feels very passionate about discussing and promoting. So I'll hand over to Suhayla. Diagnosis.
It's called Trichotillomania.
Okay, and how like out of 100%, how many people would be diagnosed with this?
Around 5 to 10, just because most people are not really coming out with it.
Okay, so it's kind of going undiagnosed.
Yeah.
Okay, so what kind of symptoms would you know, for somebody that thinks they may have it, what would be like the early warning signs and symptoms?
It's basically a hair pulling disorder. It affects you in 3 stages. You pull your hair, or like your head hair, your eyebrows and your eyelashes. Some people it will affect them in all 3 stages. Some people it will just, like myself, it's only affected me with my hair.
Okay.
And it's basically, it's just an illness where you're constantly pulling out your hair or pulling out your eyebrows or your eyelashes just to feel some sort of relief.
Okay, so are you aware when you're doing it? Are you actually conscious of the fact that you're doing it?
Not all the time.
Okay.
Yes, I am aware of it, and no, I'm not aware of it. Like, I could be sat down watching TV, you know, in my elements, not thinking about anything, and before I know it, my hands on my head and I'm pulling, and I look on the floor and there's loads of hair.
Wow, yeah.
And because I'm constantly pulling from one area,
Okay.
the hair doesn't hurt from when I'm pulling it out because it's got used to me pulling the hair out.
Okay.
Yeah, so basically it's the hair pulling, the eyebrows and the eyelashes.
Okay.
That's how you'll know. If you're pulling your eyelashes, your eyebrows or your hair, you'll know that you have trichotillomania.
And do you know how long this diagnosis could, you know, you could be living with this diagnosis?
Yeah, well with me it started from a really young age.
Okay.
It started at the age of 15, when I was 15 years old. And I'm still suffering from it now, and I'm 20, I'm going to be 27 in July.
Okay.
So there is cures, there are cures out there.
Brilliant.
And you know, I'm on the way to that, and hopefully I'll be able to show many people as well.
That would be brilliant.
You know, we can all do it together.
Definitely.
Along the process.
Definitely.
You know.
So what kind of therapy and treatment would you know, such as the mental health services, offer somebody who is suffering from this diagnosis?
The best treatment I would suggest for trichotillomania would be psychotherapy.
Brilliant, yeah.
Psychotherapy is the best treatment because they can basically bring it out from where it stemmed from.
Yes.
You know, they'll tell you from where it stemmed from. They'll help you. They'll show you processes.
Okay,
on
right.
how to do it
and how to manage it. Brilliant. Okay. And is there any form of medications that you could take?
No, not really.
Okay,
No.
right, okay. So if there is anybody out there, so if there is anyone out there, any viewers that are watching this and feel that they can relate to Suhayla's story, if it's any family and friends, even yourself, that you know you're having any of these early warning signs, you know, we would recommend, you know, go to the GP, seek some advice and some support with this, as clearly you're not alone.
And people that are trying to hide it as well, and to not be afraid to come out, because there's so many people out there that suffer with trichotillomania and they're too scared to come out. Like I have been, I've bottled it up for so many years now, since I was 15, and it's been such a horrible secret that I've had to hide from everyone, every single person. And I know 100% there's people out there that are covering it up and are having to bottle it all up just because they don't want that person to think differently about them.
Yeah.
You know, and it's not about that no more.
And it is that mental health stigma that everybody tries to hide away from it and you know, bury it.
Yeah,
you know.
it's the best thing.
But unfortunately, I think it just, you know, gets worse and it manifests.
It does. At first you think it's the best thing to just cover it up and not tell anyone, and you think that, you know, no one knows about it, so just cover it up. But it just gets worse. It only gets worse, and you will fall into a depression. Okay. Definitely.
Yeah, and that's why it's really important that we have, you know, more discussions around mental health issues, up and coming, some that are rising, and also the impact that it also has on people around us, because, you know, we need our family, friends, you know, and colleagues to support us as well, but you know, so I think it's important that we continue to discuss things like this and bring it more out in the open.
Yeah.
On a more positive note though, Suhayla is embarking on a charity event, fundraising event, which I'll let her explain a little bit more about that.
Basically, it's not a massive charity. It's just for the kids of Palestine. It's
Right.
going to one of the Islamic charities.
Okay.
And I'm getting as many people to sponsor me as I can.
Brilliant.
And basically, I want to shave off all my hair. I want to shave it off, like basically down to skin.
Okay, right, yeah.
Like that. And I'm just going to start fresh.
Okay.
I want to start fresh, and it's all a psychological thing as well, because the area where I pull my hair, I'm able to cover.
Right.
So from the time I'm able to cover it, I will continue to pull it.
Of course.
Now you see the areas from around here
Yes.
that I'm not able to cover, I won't pull, because I'm so conscious about what people are going to
Right.
think and see. So what my psychotherapy suggested was for me to shave off all my hair, and the extensions that I have that are covering the patch and what's not, to cut them up, to get rid of it, to get rid of anything basically that I know that's going to cover up the patch.
Right, yes.
And start from fresh like that, because if you shave your hair off and you go out, you're going to think, right, that's it, everyone can see how my hair is.
Yes.
I can't cover it up, I have to let it grow.
Yes,
I
yes.
can't be pulling from here, I can't be pulling from there, because when it grows out I'm going to have patches.
Yes, that's right.
So it's just basically a fresh start, and it's
That's
more
brilliant.
to do with the brain.
Of course, yeah,
You
the
know, about-
psychological pattern of it,
about people seeing it.
I'm Dani, this is Suhayla, this is Talk to Talk. Thanks for watching, like and subscribe, see you next time.